Morning everyone. Beautiful day. Gorgeous. All right. Okay. Everyone's right? Thanks. All right, well I can report that we've had 6 new cases overnight. 5 of these are in hotel quarantine and 1 is a close contact of the man. So we do have 1 in as community transmission, but he's a close contact of the man that we mentioned yesterday. So once again, that's very good news, and like I said, the next 2 days are still going to be critical for us. So we now have 71 active cases. We've had 6,881 tests that were done yesterday, and once again, and I know Dr. Young and the Health Minister will reiterate this call, if you have any symptoms, please go and get tested. If you've been to any of those sites that have been listed, please go and get tested as well. Now, we are a little bit concerned about people who attended the Carindale Shopping Centre. So that was between noon and 2:16 last Saturday. So if you were there then, we would please like you to come forward and get tested. We just want to rule out every single possibility here. So the sooner that everyone does this, the better we will be. So don't forget, please continue your social distancing, practice that good hygiene, and if you are sick, make sure that you stay at home and then organise to get tested. We've identified 18 close contacts of the man who has the original community transmission source, and the contact tracers are doing an excellent job. So I do want to thank Dr. Young and your team. All of the contact tracers are doing exactly what they needed to do. So look, I'll hand over to Dr. Young and then to the Health Minister, and then we're happy to take some questions.
Thank you, Premier. So yes, 1 new case related to that gentleman who tested positive. This person lives in Strathpine, and we're talking to him at the moment to find where he's been so we can let the community know. That information will be available later today, and we'll put that on our website. Thank you to every single person who came forward and got tested yesterday. There were triple the number of people who normally get tested on average in Brisbane who came forward and got tested, which is excellent. Please could people continue to do that. Any symptoms at all, particularly if you live in Brisbane or Moreton Bay regional councils, please come forward and get tested. And it's important that people maintain social distancing, go outside, the most beautiful, beautiful weather possible in Brisbane this weekend. So go outside, maintain social distancing, hand hygiene, all of those things are really important, particularly for the next few days as we contact trace all of the people who've potentially been infected. Thank you.
Thanks, Dr. Young.
So the main message is people should continue to check the website. So no matter where you live in Queensland, or if you've been travelling in Brisbane and are now elsewhere in the country, just check the Queensland COVID website for those venues to see if you have been there during those times and follow the direction. We have increased the directions around Mama's Italian Restaurant at Redcliffe, which now says if you have been there between those hours on the 21st that you should quarantine for 14 days. So please check the website, make sure you are aware of what the directions are. Of course, we have increased staffing at our clinics for testing, but there are lines. So we ask people to be patient and also to be respectful to each other and to the staff while they do that. We're opening up 2 more sites today at Goodna and 8 Mile Plains. And the great news about our vaccinations is in the last week we've done 21,421 vaccinations, with more vaccinations to occur today. So I thank everyone for coming out and getting their vaccination, and also to all the staff who are overseeing those vaccination clinics.
Thanks. We're happy to take some questions, or Dr. Young. Yep. Look, we are very comfortable where things are at the moment, and the Queenslanders respond incredibly well. So if everyone keeps up their testing and the contact tracing, we're very comfortable where we are. I should also add too that last night I also wrote to the Prime Minister as well, asking for the next 2 weeks to halve the number of our international overseas arrivals, I think this is very important for two reasons. The first reason is we want to be able to concentrate on this contact tracing, but secondly, we are actually seeing large numbers of positive cases that are coming in. Like basically every day over the last fortnight, we've been seeing 5 or 6 cases, and the Health Minister will give more details, but we're almost at the capacity of our hospitals that we were during the peak of the pandemic. That's not to say our hospitals can't cope, they will be able to cope, but this large influx that we're seeing and the high rates of people coming back, return travellers being positive, for the next 2 weeks I'm asking the Prime Minister to halve our number of overseas returning travellers, and I'm quite sure that he'll give that due consideration as soon as possible. It's about 1,300, so we're just asking for the next 2 weeks, just while we get everything under control, and the fact that we are seeing these, as I said, every single day we're getting positives out of hotel quarantine. Look, that's a matter for them. We are not seeing large-scale community transmission. This is the close contacts. We're very comfortable where we are at the moment, and if anything changes, we'll update the public.
What's your reaction to the football in Geelong last night, where there's been criticism that it took so long for that to happen, and what actually occurred at the ground?
That's really a matter for them. That's a matter for the Victorian government.
The new close contact has tested positive. Is that a family member who lives with this?
My understanding, it's a friend. Different household.
Okay, at one of the venues already listed, but eating lunch at the same time?
It was a close contact, yeah. Could have been at their house, yeah. 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 We'd always like to see more testing, but that's a really good indication that Queenslanders are responding, especially in the southeast here. So we do want everyone to do the right thing. So thank you for everyone who's come forward and got tested. And if you are at home and you've been to any of those places and you're sort of thinking, oh, I'm not feeling too well, don't think about it, go and get tested.
How serious is this on the scale of what we've seen to date, this latest situation?
Look, I think everything's always of concern, but, we've learned a lot over the pandemic. Our contact tracing is in place. We've got excellent contact tracers, and everyone appears to be doing the right thing. But like I said, we really want people from that Carindale shopping centre that were there for that particular period of time to please come forward and get tested. I mean, that's pretty crucial so we can rule out any further community spread. Yeah, I might get the Health Minister to address that. Okay, thanks a bit.
What we do know is cafes and restaurants are higher risk because people are sitting there for a period of time. What we learned in the last 24 hours is this gentleman had actually been at the restaurant for almost 3 hours. And so consequently that means that there's greater risk, and the Chief Health Officer's advice and Queensland Health's advice was that anyone who has been at this restaurant between those times on the 21st, so last Sunday, should quarantine for 14 days, irrespective of whether they get a early negative result from any test. So they still need to go get tested, but stay at home for 14 days. We do know these sites are at risk. Just on the issue of the testing, although we're seeing testing numbers around the same as what we did the day before, we have had a look and we've seen a significant increase of people coming out getting tested, both in Metro North and Metro South areas. So we've seen probably a decrease elsewhere in the state, but where we need it most, which is here in southeast Queensland, in northern Brisbane and southern Brisbane, people did come out in significantly more numbers yesterday to get tested, and we thank them and we ask them to continue that over the weekend.
How was the record tracing at the Redcliffe restaurant? Have you been able to find all the details of people there at that time on QR codes, or is that why you're asking?
So I've asked that question today, and that work is still ongoing to see how the restaurant has gone with its checking in. But of course, while that contact tracing is ongoing, we say don't wait for the call, come forward and quarantine yourself and get tested. But assuming that everyone has done the right thing, there should be a comprehensive list of everyone who was there for the 3 hours last Sunday that we'll be able to contact. But don't wait, get yourself into quarantine and go get a test.
Do you have any concerns in the lead up to Easter about potential lockdowns or
Oh, look, the Premier's already answered that. You know, one day at a time here. We're very happy with the response the position we're taking at this stage. We've learnt a lot over the last 12 months, as the Premier said, and we believe the restrictions we've put in place at the moment are adequate based on what we are seeing. And, of course, the next 24, 48 hours with the contact tracing will tell us more.
No, so we do have genome sequencing back, and the first 3 cases, so the person who came from overseas, the transmission event in the hotel to another person, and the transmission to a healthcare worker at the PA hospital, those 3 genome sequences are exactly the same and are exactly the same as this gentleman who's tested positive who lives in North Brisbane. So those 4 are the same, which suggests that there's probably, given timing, one intermediary between the first healthcare worker and this gentleman, we believe. There could have been 2. They're the things that we're going back and looking at. We've rechecked all of those up to nearly 900 contacts, and all of those were tested negative. Those are the contacts of the healthcare worker, so we're just looking at where else there could have been some transmission. There's every chance we won't find it, because we know people, of course, can get infected and be totally asymptomatic and then pass it on. So we just have to work that through. The most important thing, and will give us the answer, is that anyone who's sick in Brisbane comes forward and gets tested. People shouldn't think just because they haven't been to one of the venues of concern, they haven't got it. They need to come forward. Anyone, anywhere in Brisbane, or Moreton Bay Regional Council who's unwell with any symptoms needs to come forward. That's really important. We've had 4 so far, so we're just going through all of that information this morning. It would have come through overnight, but we've only seen the 1 positive.
Thanks, everyone. Premier, can I just ask one question about JobKeeper comes off tomorrow?
Yeah, I was just going to mention that, yeah.
Comes off tomorrow.
Yeah. Yeah, look, thank you, and that goes back to your earlier question about tourism. Having been up to Port Douglas and Cairns and sat down and spoken to our tourism operators, they are absolutely concerned about the fact that JobKeeper ends tomorrow. I still call upon the federal government and the Prime Minister and the Treasurer to please look at some further targeted assistance for these particular people. They work really hard, they contribute to our economy, they've got families to feed. Some targeted assistance for people in this industry would not go astray. I am very concerned that any MP would go about trolling. I mean, that's not on, and it's disgraceful. So that's a question for the Prime Minister. But honestly, in this day and age, the trolling has got to stop. I think it's about time that as a nation we actually came together and started talking about ways in which we can stamp out these practices that are having detrimental effects on women, on children and other people in every walk of life. Now, gone are the days where people used to write letters to the editor and put their name and addresses. I think it is absolutely a coward's way to be trolling people without putting your name to it, and the practice must stop. Now, going back to your earlier question, for an MP to be trolling is absolutely disgraceful. Okay, thank you.
Everyone.
Right, we'll hear about you.